Smoking is a huge problem. Around 1 in every 5 adult deaths is caused by smoking. Smoking shortens life expectancy around 10 years because it leads to atherosclerosis, cancer formation, and progressive organ failure. Smoke toxins enter bloodstream within seconds and begin damaging almost every organ, including brain, heart, lung, and kidneys. The absolute major cause of lung cancer is smoking. And lung cancer is very difficult to treat and often deadly. If you smoke regularly, your lifetime risk of lung cancer is about 20%. If you don't smoke, the risk is around 1%. Smoking also accelerates biological aging. On average, smoker looks 5 to 10 years older than the people of the same age who don't smoke. And ultimately, smoking is the strongest modifiable risk factor for the heart disease. Unfortunately, smoking cessation is difficult. Nicotine is among the strongest known addictive substances. It activates dopamine system in the brain very rapidly within seconds. Its addictive strength is comparable to heroin and cocaine. When you stop smoking, withdrawal symptoms appear within hours. Anxiety, irritability, restlessness, and strong cravings. At the moment, smoking does not relieve real stress. It only relieves nicotine withdrawal, which is caused by smoking itself. With prolonged nicotine use, the brain reduces dopamine receptor sensitivity. So when you stop, normal life can feel flat, joyless, and unmotivated. This is not depression, it's dopamine system adaptation. And its recovery requires weeks to months for emotions and motivation to normalize. The ideal situation is when a person quits smoking and never smokes again. This method is called cold turkey. But in most cases, such attempts fail. So clinically, it's not most effective approach. Only about 5% of succeed this way. That's why other methods are important. The second method is nicotine replacement therapy. The first thing you must know is this. With your first quit attempt, you will most likely fail. Because most people who successfully quit smoking have tried at least 5 times. And for some individuals, it requires more than 10 attempts. So, if you fail, it does not mean that you are weak. It means you are in the process. Every quit attempt increases the future success rate because you learn your triggers, reduce fear, and improve your strategy. The first and most important thing is this. You must want to stop smoking. You should understand that smoking cessation is not willpower test. It's a neurobiological addiction. This is not about morality. This is biology. You will crave cigarettes and this is normal. You will feel discomfort, but it will not harm you. The symptoms will fade within 4 weeks. You must remember, smoking is not helping you. Smoking does not reduce stress. It only treats withdrawal symptoms. The symptoms caused by smoking itself, not real stress, not life problems, only nicotine withdrawal. Your mood may worsen. Your concentration may temporarily decline. And this is normal. Everything will return normal soon. Remember, most successful quitters needed multiple attempts. You should also know that your brain will exaggerate benefit of smoking. During craving, the brain lies. And remember this, you are not giving up pleasure. Long-term smokers don't feel happy when they are smoking. They feel normal. Real pleasure returns after neuroadaptation, not before it. Fear of weight gain is mostly psychological. Yes, some weight gain may happen. On average, it's about 3 to 5 kilograms. But people usually fear much more than that. And because nicotine creates strong dependence and predictable withdrawal symptoms, the core and first-line treatment is nicotine replacement therapy. First, for treatment, nicotine patches are used. They provide a steady nicotine level in the blood and prevent baseline withdrawal symptoms. The key idea is nicotine itself is far less harmful than the other toxin components found in cigarette and cigarette smoke. That's why with nicotine replacement therapy, we reduce withdrawal symptoms and help the body to stop smoking safely. But the problem is that nicotine patches alone are not enough. They must be combined with fast-acting nicotine, such as nicotine gum, nicotine lozenges, and in some cases nicotine spray or inhalers. Especially if withdrawal symptoms are strong, patch dosage is individual. It depends on how much you smoke per day. After about 2 weeks, the dose can be reduced or halved. Important point is that patches does not stop sudden cigarette cravings. It only prevents background withdrawal. That's why we need fast-acting nicotine also. This can be nicotine gum or nicotine lozenges. Studies show that combination nicotine replacement therapy is safe and optimal. It does not increase risk of cancer. It does not increase risk of cardiovascular disease. It is considered safe and effective. A common mistake is keeping rescue nicotine, the gum or lozenges. They should not be kept because keeping leads to stronger cravings. The minimum effective duration of nicotine replacement therapy is around 8 to 12 weeks. If used for a shorter period, relapse risk is higher. It can be used even longer depending on the person. Fast-acting nicotine can be used for months if needed. There is no fixed stop date. You stop when craving becomes rare and weak. Tapering is required. First, reduce frequency, not dose. Your first and most important goal is no smoking, not zero nicotine. This is exactly why nicotine therapy works. You should also shift your identity. Instead of saying, I'm quitting smoking, you say, I'm not a smoker, using treatment. Cravings will come, and you should expect them. But you must remember, a craving always passes, usually within 15 minutes. With combination nicotine replacement therapy, your chances of quitting reaches around 30%. This is one of the highest success rate compared to about 5% when quitting without medication or support. If cravings remain severe after 2 weeks, the dose should be increased or second patch can be added. If nicotine replacement therapy fails, it is usually switched to varenicline or used in combined strategies. And now let's talk about this medication. Varenicline is medication very interesting because it partially stimulates and partially blocks nicotine receptors. This is its unique dual mechanism of action. As a result, when you stop smoking, you have no withdrawal symptoms or only minimal ones. And when you smoke, you don't get reward. You don't feel pleasure. So medication works in two different directions, relieves withdrawal and reduces dopamine spikes from cigarettes. You may still smoke, but you feel flat. The cigarette loses its effect. At the same time, the medication maintains low steady dopaminergic tone and prevents dopamine crashes responsible for irritability, anxiety, cravings, and weaker. And when you know that smoking will not give you relief or pleasure, quitting becomes easier. This medication is superior to nicotine replacement therapy. Its benefit may persist even after discontinuation because habitual reinforcement is weakened during the treatment window. The greatest benefit is usually seen within 12 weeks. This medication is recommended for people who smoke more than 20 cigarettes per day, those who failed nicotine replacement therapy, and individuals who relapses after just one cigarette. Varenicline protects against this relapse pattern. It's useful for patients who fear weight gain because it has neutral or slightly protective effect on the body. Varenicline should be started 7 days before quit date. This allows nicotine receptors occupancy before stopping cigarettes. Treating usually begin with low dose 0.5 milligrams once a day for the first several days, then 0.5 milligrams twice daily, and after about 1 week, 1 milligram twice daily. It's usually taken with food and water. Standard treatment duration is 12 weeks, and it can be exceeded to 24 weeks if needed. Don't skip dose during cravings. Don't stop abruptly if cravings persist. In terms of safety, it is considered safe. It is even safe in psychiatric conditions such as depression and anxiety. Possible side effects include nausea and insomnia. There is no significant cardiovascular risk, no cancer risk, and no liver toxicity. It's not recommended with alcohol because it may increase intoxication and behavioral effect. It can be combined with behavioral therapy. Combination with nicotine replacement therapy is possible, but it should be done under professional supervision. And now let's talk about key factors you should remember. For successful treatment, behavioral therapy is crucial because withdrawal ends and biology is stabilized with medication or nicotine replacement, but habits remain. You must identify your triggers. Common triggers include coffee, stress, driving, boredom, alcohol, and the brain learns a pattern within this situation, and you use nicotine and you feel relief. You must recognize this trigger. Once you recognize them, you can rewire and remodel the behavior. For example, morning coffee, then cigarette. Now it becomes morning coffee, pause, and alternative action. This alternative may be movement, short exercise, water, or breathing. You should remember that cravings are time-limited brain events, and they usually last around 15 minutes. Cravings rise and fall like wave, but your goal is not to fight them, but to insert delay. When cravings hit, delay it about 10 minutes, and with repetition and success, your brain learns that urge passes. Breathing, movement, cold water, walking, and grounding are especially helpful during stress-related cravings. Another critical step is identity shift. I'm a smoker is deeply encoded in the brain, and you should say, I don't smoke. This change is essential. Don't expect happiness too early. That expectation often leads to disappointment. Avoid unrealistic timelines. Mood and pleasure recovers gradually. Supportive environment is crucial. If smokers are around you, the risk of relapse is significantly higher.